Hello and welcome to this episode in our series on neurodevelopmental disorders. Whenever you talk about neurodevelopmental disorders, people always come across a particular term called as autism or autism spectrum disorders. In this particular episode, we will try to understand some of the fundamental concepts related to autism, including its definition, symptoms, signs, and its diagnosis and our current understanding about the causes leading to autism. Come, let us meet our expert.
Autism is a neurodevelopmental disorder. It means the problem is with the developing brain. Usually the brain develops in a particular trajectory. There are certain processes that are happening when the child is still in the mother's womb, immediately after birth, and more so in the first 2 years. If there are any particular differences with this brain development, it can result in different disorders, one of them being autism. Autism was initially understood to comprise of a set of symptoms of a particular level of severity. Over time, the understanding has changed. There is a saying which goes by, if you have met one person with autism, you have met only one person with autism. It means that autism as a disorder is very different even in two individuals. So autism spectrum disorder came up to have this understanding that autism can present with different levels of severity, different strengths and difficulties may be seen, and there are different levels of comorbid disorders that can present with autism. So autism and autism spectrum disorder are basically the same. So autism has primary impairments or deficits in socio-communication domains. By socio-communication related milestones develop at a very young age. To give a few examples, a child who is almost like 3 to 4 months of age will look at the mother and smile. At around 9 to 10 months will start looking at the direction that the parent is pointing. The child will enjoy games like peekaboo. They'll be able to share activities when they are about a year age. And when they are about 12 to 15 months of age, they'll start pointing if they need something, or they'll show something like look with a very happy expression. They'll tend to share their joy with their parents. All these are expected socio-communicative milestones that will happen in the first year and first 1.5 years of life. In autism, it will be observed that some of these milestones may not develop or might have been attained, but over time in the second year the child may start losing some of these milestones. And usually children by about 1 year of age start saying mama, baba, dada. They'll say bye when you say bye to them. Some of these skills might be achieved but lost in the second year. So these are all very early indicators of autism. Definitely children may start exhibiting some of the signs of autism at a very young age. If the disorder is more on the severe end, even in the first year of age, it is possible to identify a lot of signs where the child may be at a high likelihood for autism. So the idea for diagnosing a disorder is when the child already has all the symptoms or they meet a criteria for diagnosing a particular disorder. But at a younger age, when we identify a child may be at high likelihood, that is, there a possibility that the child may develop autism in the course of time, it is important that we start doing interventions. Interventions are simple play-based activities which are focused on improving the communication and the social interactions with the child. This can definitely start at the earliest when there are any red flags, any concerns that the parents identify, instead of really waiting for the diagnosis to be made. Of course, formal diagnosis is important, but even before a formal diagnosis, treatment can be started. And it will definitely help children to improve in terms of their development. There is a lot of research going on in terms of understanding what is causing autism. At this point, research indicates that autism is largely genetic and multifactorial. Genetic meaning there are a lot of genes, about more than 100 genes are identified to be associated with autism. A lot of genes carry small risks, and when they come together, they have a cumulative risk, or they have a larger risk to cause autism in a given child. Only about in 20% of cases, where we call them as complex autism, where there may be a particular gene that could be identified in genetic tests, or a particular disorder, genetic disorder could be identified as a cause for autism. In addition to genetics, there is a lot of research going on to understand if there are other possible causes or etiology for autism. Immunological mechanisms, or infectious mechanisms, gut microbiome, are all being largely investigated. However, the current understanding is that autism is genetic and multifactorial. It will be difficult to pinpoint to a particular etiology in any given child. Autism is a genetic disorder and it is multifactorial. So, genetic doesn't mean it has to be hereditary. Not all children with autism inherit the risk directly from their parents, but there are certain cases where the risk in the family can be high. For example, if a parent has autism, or if the first child has autism, then the risk for the second child to have autism could be higher. In that way, there are certain risk factors within the family, but it is not always transmitted from the parents to the child. So, it is important to keep in mind, if there is one child with autism, the risk for the second child, the sibling for that child, is also present. The risk varies from about 3 to 10%, or in some cases maybe a little high as 20% also. It means, the risk means that the second child may have anywhere between 3% to 20% chances of having autism again. The risk is not only for autism. The second child may have risk for developing any other neurodevelopmental disorder like ADHD, or language delay, speech delay. It could be any of these disorders. So, it is important to have something called developmental surveillance for the second child, that is to be observant if the child is developing and achieving milestones according to the age. If there are any concerns, to immediately flag them and take a consultation to ensure the development of the child.
This concludes the episode on Introduction to Autism. In this episode, we understood some of the fundamental concepts related to autism, the signs, symptoms, the way it is diagnosed, what is the current understanding about the causes of autism, etc. We will be back with our next episode. Namaste.